You touch a hot stove, pain. You sprain your ankle, more pain. But what if your pain lingers weeks, months, years with no clear injury? Now what? Let's become more aware together. Pain is governed by a brilliant alarm system. This alarm system evolved to protect you. Acute pain, like the kind you feel when you break a bone or cut your hand, is your body's way of saying, hey, pay attention, we need to protect this area while it heals. What happens when the alarm doesn't shut off? I see this all the time in my chronic pain program. People who think they must still be injured because they still feel pain. But here's the truth. Chronic pain isn't always a sign of ongoing tissue damage, and actually, it's usually not a sign of ongoing tissue damage. More often than not, it's your brain's alarm system stuck on the on position. And that misunderstanding can keep people trapped. So, let's break it down. Acute pain is short-term. It's from an identifiable injury or illness. A twisted knee, a dental procedure, surgery, and it typically resolves as the body heals. Chronic pain, on the other hand, lasts beyond the typical time for tissue healing. Usually that time is within about 3 months. Sometimes that pain will persist even beyond those 3 months without any new inciting injury or tissue damage. And this is where things start to get tricky. Imagine your house had a fire. You installed a smoke alarm. But after the fire was put out, the alarm kept blaring for weeks. That's like chronic pain. The danger is gone, but your system still hasn't gotten the message to stand down. When people assume that their chronic pain must mean something is still physically damaged, they often rely on what are called passive treatments. Meds, injections, surgery, chiropractors, massage, acupuncture. These can sometimes provide temporary relief, but they come at a cost. Passive treatments rely on something external to the person, and research shows they usually don't help people regain lost function. They keep you stuck, dependent, waiting for the next dose, the next appointment, the next miracle. And this mindset can make recovery harder because many of the most effective treatments for chronic pain require active participation instead of receiving the treatment passively. It might surprise you. The best treatments for chronic pain aren't always high-tech or hands-on. They're active treatments, ones where the pain relief comes from you. Examples of these that work are pain neuroscience education, where you learn how pain actually works, personalized physical therapy, pain reprocessing therapy, movement retraining, cognitive behavior therapy, mindfulness and relaxation training. These methods help your brain and body rewire how they respond to pain. But here's the catch. They're only going to work to the extent that you believe that the pain is not necessarily a sign of ongoing injury. They're only going to work to the extent that you believe that the pain is not necessarily a sign of ongoing injury. And that is a huge leap for most people. And I get it. Pain feels like something must be wrong. You're biologically wired to think in that way. And the healthcare system, it doubles down on that idea. Doctors order scans. Scans show something. But not everything we can see on imaging causes pain. In fact, plenty of pain-free people have herniated discs or joint changes that are visible on MRI. So if you think there must be something wrong with my body, well, you're not alone. And you're also not alone in having an incomplete picture of what's going on. And this is where it gets even more complicated. People in chronic pain often have multiple pain sources. You can absolutely have real physical injuries and chronic pain from an overactive system. You might have CRPS in your arm, and you can also stub your toe still. The toe pain is acute. The arm pain is chronic. Your brain has to sort all of that out. Pain is not just a signal from the body to the brain. It's constructed by the brain on context, memory, expectation, fear, attention, and emotion. That means your pain is real. It's just not always a sign of damage. So, what's the takeaway? If you're in chronic pain, it might not be about fixing broken tissue. It might be about retraining your system. And that starts with a shift in mindset. Shifting from, I need someone to fix me, to, I can become the expert of my own healing. We don't just treat bodies, we treat nervous systems. And your nervous system can change. That's the promise of neuroplasticity. And that is why I do what I do. If you want to learn how to calm your overactive pain system, subscribe and check out my next video on how thoughts, movements, and attention shape your pain. Because your pain is real and your recovery is possible. Thanks for being here, and let's become more aware together, one step